You know, I think what we've not gotten in touch with in this country, and this is one of the things I would say to our new president, is that we take it for granted. For example, public education is a right. Every child in our country has a right to public education, but we have really never grasped the idea, in my opinion, that every American should have a right to basic health care.
We started with the idea that we wanted to do health care for the underserved. Basically, we were seeing patients who came in with no money and no insurance, and our team, our residents, and our teaching program was taking care of them in the hospital. But about 1997, we said, you know what, we really want to be more out in the community to help take care of the patients out there in the community. And when we did, we actually found a vacant apartment in the housing complex, and that's where we actually started.
They give me medicine for everything that is wrong with me, that is in their scope, and it's just been a blessing. And the fact that it's at my church, you know, for some reason I come to, you know, if you got to see a doctor, you feel more comfortable in surroundings that you're familiar with.
One of our major donors has said we really need to do this as a free clinic. We have a number of people who are like corporations or even foundations who've gotten behind us now and said this is really good care and we want to help sponsor and develop that. We have churches that get behind it, and seeing a few patients to 13 sites and over 7,000 patients in specialty clinics and 2 mobile medical vans. The expenses have considerably gone up.
First, I think we have all learned that America needs to provide health insurance for all Americans, because we need to address the concerns of those who have insurance as well as those who do not. We've gone from 39 million uninsured in 1994 to 47 million today, from spending 14% of our gross domestic product for health care to spending 16%. And now we are spending 50% more per person than the next highest spending country in the world, Switzerland, which has high quality and good outcomes for the people there.
I won't claim to be an expert on the Hillary Clinton health care plan, but any of the health care plans that border on a universal coverage by, in fact, the government is really fraught with a problem of going to be very, very expensive. The government has never been known to be very efficient. The government has always been known to underestimate the cost for what it is they're wanting to do. And the problem that I can see is that it would really escalate the cost of health care for the whole healthcare system in the United States.
I am for government-provided health care. I believe that the United States should, at a minimum, provide for its citizens to be healthy, and it's the basis for a firm economy. And I think that what it will do by having services that are available to the population as a whole, it will stop the emergency room from being the primary care facility. It will allow for wellness care, which is a lot less expensive than acute emergency care is concerned.
So if it's a government program that exists like a lot of government programs where they just become sort of like, okay, next, and you know, the next person comes in, patients are going to still want to have some kind of a better quality care than that, somebody that cares about them, somebody that really helps to sort of say, let's look at the whole picture here and tries to help lift you up. One of the things that's happening now until we get to that point is our Good Samaritan Health Services, our mobile medical vans. What I like about that, of course, is that the churches that partner with us see as a goal not just helping the patient through a medical problem, but how do we help raise the patient up to where they're more self-sufficient? They're finding an ability to have a job. They get some help for child care in the afternoons, or after school care for kids, or tutoring for their kids, or whatever, where the church ministries become involved in helping to raise up in what I call transformational ministries to really help people have a lot better health care and a lot better life.